Hello and welcome everybody. Thank you very much for joining us today for our webinar, where we're going to be discussing a guide to powerful youth-led advocacy, engagement and leadership as we're thinking about public policies and sustainability for our future. It's important for us all to recognise the real need to invest and to empower our youth as we're both the present and we're the future as well. So my name is Sophie Minoy, and chairing today's proceedings alongside me is Stephanie Whiteman. Today we'll hear from a distinguished panel of inspiring young leaders who are all doing amazing work across the globe. And I've no doubt that we'll learn lots from them today and we'll be inspired in our journeys to become powerful advocates and leaders. So before we get started, I'd like to just say a quick thank you to Friends of Cancer Patients and the AstraZeneca Young Health Program for their ongoing support. And we'll just cover a few housekeeping topics. So firstly, today's webinar will be recorded. So we will be able to share a link with you after the event is completed. And please feel free to share that link within and beyond your networks to continue discussions, and we'll have that available at the end. Secondly, we invite your comments and questions throughout the webinar today. So we'll have a Q&A segment at the end of our panel discussion where you're welcome to ask questions to our amazing panelists, but also feel free to use the chat box to comment on the discussions as they're happening. We'd like to have an interactive and engaged webinar session today, so use that as much as you like. And without further ado, I'd like to start by introducing each of our incredible panelists and asking them to introduce themselves. So we will start with Danielle.
Thanks, Sophie. So hello, everyone. My name is Danielle Walwyn, and I am the Advocacy Officer of the Healthy Caribbean Coalition. And the Healthy Caribbean Coalition is a network of civil society organizations in the Caribbean, really focused on the prevention and control of non-communicable diseases. So we do all that we can to empower the civil society voice in that NCD conversation. And I'm also the coordinator of Healthy Caribbean Youth, which is the HCC's youth arm. And we do all that we can to meaningfully engage youth in the NCD space. And lastly, I'm a fitness instructor, so I really enjoy getting people moving. Thanks, Sophie. I'm really looking forward to the discussion today.
Thanks, Danielle. It's fantastic to have you here. Joab, would you like to tell us a little bit about yourself?
Yes, I would. Thank you so much, Sophie. My name is Joab Wako. I'm based in Nairobi, Kenya. I am a patient advocate and a person living with an NCD. So I went through kidney failure in 2015. I've been living with kidney disease for the last 8 years, and I got a kidney transplant 7 years ago, and that's what sparked off my advocacy. I founded an organization called Transplant Education Kenya that raises awareness on or about organ donation and transplantation here in Kenya. So I'm really excited. Thank you for having me, and back over to you, Sophie.
Great, amazing work that sounds like, Joab. Bonita, would you like to introduce yourself?
Yes, thank you, Sophie. Hi, everyone. My name is Bonita Sharma, and I'm from Kathmandu, Nepal. I am the co-founder and CEO of Social Changemakers and Innovators, in short, Socha Youth for Nutrition. We primarily work with women, children, and adolescents on the issues surrounding public health and nutrition through innovation, education, and entrepreneurship. And we are particularly recognized for our award-winning low-tech innovations. The bracelet that I'm wearing, the nutrition bracelet and the menstruation bracelet, which are simple wearable tool that helps mothers learn about nutrition and child feeding, as well as adolescents to track and understand their menstrual cycle in a very simple way. We primarily work with young people, and just recently we've started working on the issue of NCDs by engaging youth as ambassadors for NCD advocacy. I'm so glad to be a part of this conversation today and looking forward to hear from everyone. Thank you.
Thank you, Bonita. Pierre, please go ahead.
Hi, good morning, everyone. You know, it's kind of hard to come after these wonderful panelists, but just very quickly, my name is Pierre Cooke Jr. I do many things, but for today's purposes, I think it's important for you to know that I have a deep passion for creating equitable systems for all, but especially those persons who are most vulnerable. And I basically committed to using my voice and platform for youth representation, and I will continue to do that for as long as I can. As it relates to the technical stuff, I'm the Youth Technical Advisor for the Healthy Caribbean Coalition. I'm also a member of the NCD Child Young Leaders Program, former member of the AstraZeneca Young Leaders Program. I'm the former Prime Minister of the Barbados National Youth Parliament, president of the Cape Hill Law Society, and I'm also an advisor to the United Nations in Barbados and the OECS. But I want you to leave with, my name is Pierre, and I have a passion for human rights and protecting the most vulnerable. Yeah.
Thanks so much for that, Pierre. That was fantastic. And finally, Enow, would you tell us a little bit about yourself?
Thank you, Sophie. This sounds very threatening after listening to all the biographies, but with my self-confidence and strong hope about my own self, I will be fit to present myself. So my name is Enow. I am from Cameroon. I am a clinical officer. I do a lot as well, but within the confines of this session, I am the advisor for youth CSE and youth programming at IPPF, the International Planned Parenthood Federation for the Africa region. And I manage youth programs and also ensure that young people are meaningfully engaged from development of projects to the implementation. And also I provide healthcare services to adolescents and youth, especially around NCDs, but also around sexual and reproductive health. I'm also an NCD Child Young leader for the past 2 to 3 years now. And yeah, that's about myself. Thank you, and over to you, Sophie.
Thanks, Enow. What sort of incredible expertise and passion we have in the group present today. I'm feeling very inspired just hearing about your introductions. So I'll hand over to Steph now.
Thanks a lot, Sophie. So now that we've heard a lot about our panelists, we would love to hear more about our audience and get to know you a bit more. So I would like everyone within this webinar today to scan the QR code or log in to mentimeter.com using the code 54036009. And there's also a link in the chat as well. So head over to mentimeter.com and let's have some fun getting to know each other. Okay, so I hope everyone is at Mentimeter right now. So I would like to know what kind of age groups are present today in this webinar. So please select which age group you belong to. Okay, I see we have some of our, we have some young persons, we have some older youths within the webinar today. Great to see everyone on. If you are able to log on to Mentimeter, go ahead and select your age group, which you belong to. Great to see so many young persons a part of today's meeting. Great. Okay, so now that we've heard a little bit about our age groups, I have a feeling that we have persons from all over the globe today. So why don't you let us know where you're joining us from, what country, what region, let's know. Let's see, where's everyone from? Wow, we have persons from Barbados, Kenya, Thailand, South Africa. Oh, wow, we have persons from all over the globe right now. I think we're hitting almost every continent, which is amazing to see. Anyone else? I'm seeing many people from Africa and Asia. For the Caribbean, we have representation from the Middle East. It's awesome. Fiji, wow. Someone saying in chat also from Kenya. It's so great to have everyone on the call. It really shows, you know, the interest from all over the globe about youth advocacy. I'm really excited about that. Now, do we have any youth advocates on the call with us, or do you identify someone as a youth advocate? Oh wow, a resounding yes. Great. So I'm hoping that by the end of today's session, everyone would be able to learn and improve along your journey as a youth advocate. And do we have any youth leaders with us? Do you identify someone as a young leader? Okay, we have some yeses, we have some nos. I'm hoping by the end of this webinar, those nos will turn to yeses. Great, and I'm hoping for the ones that are yes, and you identify as a young leader, you will learn from today as well to improve yourself as a young leader in your field. And now we would like to think about when we think of being a young leader, there are certain characteristics, there are certain adjectives that we think about. What do you think it takes to be a young leader? Okay, we see passion. What are some other adjectives? Determination, optimism, commitment, confidence. Oh, these are really emotive, powerful words. I see drive, having resources, networking, wisdom. Great, great words. And I truly believe that all of these combined really creates a well-rounded young leader. And I have no doubt that everyone on our panel, as well as everyone joining this call, has some semblance of these qualities within them as well. And I'm hoping at the end, we'll be able to bring these out of you. So I'm gonna hand over to Sophie now. Thank you so much for taking part in our mini poll. And let's get on with the webinar.
Thank you so much, Steph, and to everyone for participating in that session. What fantastic words we had at the end. And I could see passion was right in the middle. And I think there was lots of people that had put passion in particularly. And I think we can all tell there's lots of passion around the table and in the audience today. So now we've got to know our audience a little bit better, we'd like to hear from some of our fantastic panelists. So firstly, to you, Joab. It is often said that anyone with passion for a particular issue that wants policy change or reform can become an advocate, but not everyone takes those additional steps to become a leader. What are some of the additional steps that you think are needed to take advocacy to that next level of leadership?
All right, thanks so much, Sophie. So I believe that leaders are made and not born. So you need to put in the work. So you need to go learn what type of leadership resonates with you and put in the work to become that kind of leader. So it's really, really important. I saw commitment up there as one of the words, and I feel like that's one of the things that you really need to focus on. And then also finding someone who can guide you, finding someone who inspires you, to guide you, to help you grow, so that you're able as a young person to, kind of see yourself and how other people see you, and they can help you grow to become the kind of leader that you would like to be. And lastly, I would say find platforms with people who share similar interests as you. Being a leader isn't an easy path, especially when you have a cause you're championing or as an advocate. So it helps to have friends who can encourage you as you lead and become a leader. And the Young Leaders Program or the NCD Child is one of the greatest platforms I've joined that's really, really helped me, grow as a leader, move from just a patient to a patient advocate. So those are the things I would say you need to add, to put into it. Yeah.
Thanks, Joab. I could not agree more. Bonita, you've had first-hand experience making that transition to leadership. Are there any additional practical steps that you think are needed to take advocacy to leadership?
Yes, definitely. I want to start with my own personal story and experience. Like when I was a teenager, I used to believe that leadership is something that you're born with. And I felt like I was not blessed with that sort of skill. So when I was a young teenager, I used to feel like, there are several issues that I was passionate about, but I never had the courage to take a step and take an action to participate as a leader. Because I used to think that I need to be more mature and I need to have more adult abilities to become a leader. And of course, since our childhood, we're always told that young people are the future of our country, but we're never taught that, we are also the present. So I've had to go through a lot of unlearning and relearning to break the barriers and become a leader that I am today. When I reflect on my own personal journey, some of the few milestones that I feel that I achieved to become who I am right now is, first thing, I started to get closer to the community during my undergraduate degree in public health. So that helped me get connected to the local community and learn the skill of empathy. So that was the first thing that I feel is very important to become a leader. Second thing is to be able to reflect on yourself, like not just your strength, but also the areas of improvement, and then consistently invest in yourself and build on yourself. Because like when I reflect on my journey, one thing that was constant was commitment. So I feel like you need to have that passion and commitment ongoing, because leadership sometimes is also a very challenging journey. And the other point that I want to highlight is obviously a network and a team, because without a good team, you can never be a good leader. The third thing is to have a team that shares your values and vision, because guiding a team towards a common goal, in our case, malnutrition was one of the major issues that we wanted to highlight. To have a team with like-minded individuals who support you in that journey is very important. So teamwork and networking, of course. And another thing that I want to highlight is, since our childhood, we've been told about failure and why we should fear from it. But that kind of hinders your ability to take risk and get out of your comfort zone and become that leader that, you know, we always envision to be. So it's important that we take risk. And obviously the other basic things is the resources, the capacities, building opportunities that we need to strive on towards. So yeah, I think those are the few points that I want to mention, reflecting on my own personal journey. And obviously, we also need to be always open to feedback and consistently work on improving ourselves. So yeah.
Thank you, Bonita. So I'm hearing some common themes between already between our speakers, and highlighted there. We had commitment and networking was commented on by both Joab and Bonita. Pierre, what have you done to mold yourself into the leader that you are today? Were there any practical steps that you took on that journey?
Yeah, thank you very much, Sophie. It's very interesting listening to what was shared by both Joab and Bonita, because I feel like we all, even from different parts of the world, have had similar experiences in moving from an advocate to a leader, or even just developing in this space. And I think the common thread that you will hear coming through is that there needs to be a certain level of courage as a young person to take up whatever it is, whatever area it is that you want to get into. Personally, for me, I had to develop the courage to step up to be a leader. There were many instances where I was asked to lead certain groups or organizations, and I lacked the courage at the time to do it. But before you do all that, I think it's important for young persons, or if you were looking to be a leader, to understand who a leader is. And a leader is not someone who is just the boss of everyone else, or who just tells everyone else what to do. It was always my personal position in my leadership roles from as young as high school, when I was head boy, even as Prime Minister of Youth Parliament, that I don't want the people on my team to listen to me or to work with me because of the position or because the title is senior. I necessarily want people to listen and work with and follow my instruction or guidance because they believe in what I believe in, and they believe in my vision. And so like adding to what Bonita said, is important for you to know and to build your capacity as a leader so that you can inspire others. Being a leader is about having the courage to inspire and the courage to lead. I think another practical thing I had to learn was also to know when to say no. As leaders, you also have to understand that you are responsible for your own mental and physical health. And so sometimes you have to take a step back and understand that, okay, this is too much and I will not be able to give my best if I am not at my best. And I think we all know the saying, maybe in different languages, you can't pour from an empty cup. And the final thing is that you also need to learn to work well with others, or actually learn to depend on your team. And that's something I had to learn, and something I'm still working on learning, how to work with the team, so that being a leader doesn't mean that you do everything on your own, or that you make decisions on your own, or that you do everything in your head and then everyone just figures it out. That's an autocrat. So the final thing or skill I have to, or I am developing in terms of leadership, is working well with teams and learning how to coordinate and communicate and getting the vision from up here to the rest of the team so that we can all work together to achieve our goal.
Thanks very much, Pierre. And I really enjoyed your comment about remembering to look after yourself as well in your leadership journey. So my next question now, I'll direct at both Enow, and then we might follow that with Danielle. So what have you done to mold yourselves into the leaders that you are today? Did you have any particular practical steps that you took?
Yes, thank you very much, Sophie. I want to also comment on the remarks made by my former panelists, the panelists that have spoken before me, so that I agree with what they have said. Growing up as a young boy, I saw in me the possibility of changing something. Now, I believe that advocacy and leadership comes through locating or identifying a problem and being mad about that problem, being uncomfortable about that problem, because within that is born the initiative or the passion to solve that problem. So I think the practical steps I took personally within my journey was that I began volunteering while I was still very young. Based on the problems I saw, I gave in my time and energy for no pay because I wanted to solve a particular problem. And one thing I always tell my peers is that you don't volunteer after school, you volunteer before and even in school. So during the weekends, I was a medical student. During the weekends, I went to the community. I was doing testing for HIV, cervical cancer while I was still in the first year of medical school. And all of these gave me the field experience. I could understand what the common man is going through at the level of the field. Now, even within my studies, I made sure that I was not focused on the specific thing I was studying. I diversified my skills. So the next thing is about diversification of skills, because people think that once you're a doctor, you remain a doctor. No, it doesn't stop you from learning about law. It doesn't stop you from learning about what happens in the community. It doesn't stop you from learning about entrepreneurship. So diversifying your skills. So I think one of the things that helped me was the fact that I went to do other things like project management. So while I was studying medicine, I was taking a side course on project management. The next thing I did was that I realized I identified the problem in my community, which was FGM, female genital mutilation. And while I was still very young, I had to study and learn how to advocate to stop female genital mutilation. So my next advice would be to invest in yourself, because many a times we cannot advocate for something we do not know or don't understand. So the next thing I did was that I got knowledge. I read books. I could read a book which was not related to my studies. I wasn't reading to pass exams. I was reading to understand and to use that knowledge to apply it and solve a problem. So my father used to tell me, there is no way you can invest in somebody if you don't have that investment in you. And so the first step is investing in your personality. So the thing I did was I made sure I read books. I got any information I could get just to make sure that I can solve a particular problem. Next thing is networking. I made sure that I could network in most events. If I meet someone that I have identified the skill which I require from that person, I make sure that person becomes my friend. So I network with that person just to understand what that person has been through and how they did to become who they are, what they did, the practical steps. So I think networking was really very strong for me. And I made sure that I could create those networks that helped me all along my life. The next thing is also about identifying your niche. I identified my niche. Where do I excel? It's not being everywhere, it's understanding. Where do you excel? Where is that place where you see yourself excelling? And that is how I said, no, with what I am saying, okay, let me just say this. When I left high school, I did biochemistry for 3 years. I had a degree in biochemistry. But with that, I was empty. I wasn't fulfilled. Even though with a degree in biochemistry, I said, no, this is not my place. when I started doing medicine, I could see myself solving problems while I was still a medical student. So I understood that my niche is in healthcare. And so let me focus on healthcare. So I think one other thing is identifying your niche and going for it. Run with it and be consistent with it. So to me, these are some of the practical steps which you can take, to improve ourselves on having the capacity to advocate and to become a leader. I think I will stop here, but I would continue with the other questions. Thank you, and over.
Thank you, Enow. I love the points about diversification of your skills. And I think in some way, many of us probably do that without actually thinking about that as what we're doing. I also want to comment that there's a few notes in the chat of support of your points on investing in yourself and on the importance of networking as well. Would you like to continue on, Danielle?
Yeah, just to add two things, Sophie, I'm feeling super, super inspired by all of my fellow colleagues, panelists. And so just to add in terms of my experience, two things. So I loved Enow's point on the diversification of skills, and I would always also say diversification of experiences. So I had the opportunity of working with grassroots organizations in the health space, as well as more high-level ministerial. I'm super grateful for these experiences, just to see how all of these organizations are working towards the same overarching goal of improved health, but how they have to do it a little differently. And in that experience, I was able to learn and be exposed to different leaders and how they lead. So that's one thing that I would say, and I can hear it from all of our panelists before, is that exposure to learning from different leaders in different spaces. And the second thing I would say is we have, all of us, it's such a privilege to be in this position as youth advocates and youth leaders. And one of the things that I think, allows us to really grow in this space is when we have the opportunity to bring more young people to work with us on specific issues. We learn so much from other young people. And so that's one thing that I've learned as being advocacy officer and coordinator of Healthy Caribbean Youth is the power in bringing young people together from diverse backgrounds with diverse experiences to tackle all of these topics, as Enow said, that we're so passionate about. So I'll just end with those two things.
Thanks, Danielle. I'm also feeling very inspired by our speakers today. I'm going to pass over to Stephanie now to ask the next set of questions.
Thanks, Sophie. I just want to reflect for just 10 seconds. I love everything that was said. I love the piece about investing in yourself, taking care of your own mental health and well-being as well, networking, that is very important, diversifying everything that's being said so far. It's very true statements. I just wanted to reaffirm all of that is being said. So I want to pose a question now to everyone on the panel. Given that we are all young persons, we are all relatively new in the bigger sense of the word to our field. What are some of the challenges young leaders have compared to some of our more experienced colleagues in our advocacy and health field? Who would like to go first? Joab, I see you smiling, so I'm going to pick on you.
All right. Thanks, Stephanie. I'll give everyone else a break. So I think some of the challenges I have seen as a young leader or as a young advocate is we're not taken seriously. So maybe you're invited to a platform, it could be a high-level platform, and you're there to advocate and to push for your cause. And I like what Bonita said, we're taught that young leaders or young people are the future, not the present, you see. So there's an attitude of wait for your turn, you're still young, you have time. So our issues or the things we advocate for, the things we really push for, aren't taken seriously at the time we do, at the time of advocacy or when we're there advocating for it. So it can be quite frustrating because the issues we face are real and they're happening now, they're current. And it's super important that we keep on pushing for those. So that's one big challenge I've seen. And then another one is the platforms, where there are not many platforms that are available or accessible to young people or young leaders like ourselves. Like I said, there's a wait your turn kind of mentality. And if you're not courageous enough to stand up and say, hey, I'm going to that platform and I'm going to speak my truth, it can feel very intimidating. So yeah, that's a huge, huge challenge. And then lastly, I would talk about financially. As for myself as a patient advocate, like my cause to raise awareness takes money, you know, and if I don't have the money to go out there and talk about my cause and really reach out to people, it's very challenging. And as a young person, most of the time, maybe you don't have the networks to fundraise or to get the funding. So you might supplement it with something else, which is a challenge. So you can't really focus on advocacy the way you'd like to. So those are the challenges I've seen. I'll hand it back over to you, Stephanie. I think the other points my fellow panelists can talk about. Thank you.
Thanks a lot, Joab. And I see all of our panelists nodding and as you spoke, and I think it resonated with a lot of us, even those who are not on the panel and everyone on the call, that I know that feeling of you're not being taken seriously, that feeling of, wait your turn. We've all, we are in the position now. We'll take your point, but we'll put it to the side. I think we've all experienced that at some point in our lives and at some point along our journey. Does anyone else want to hop on and add a point or two on the panel? Bonita?
Yeah, no, because I wanted to add on a practical example of how and why we're not trusted enough. So when we started working in the field of nutrition, and we came up with this idea of the NutriBeats or the nutrition bracelet. So it was a very simple low-tech tool. And then, we started doing advocacy around maternal and child nutrition. We went to government offices, to explore potential opportunities of collaboration, but they did not take our ideas seriously. They did not give us enough time to listen to our ideas. And then later, like 1 year later, when we got recognized globally, when we received an award on an international or a global level, and then they came around and they were like, okay, we're very proud of you. That's such a hypocrite behavior. Until and unless there's some international standard stamp on you, you are not taken seriously. And I feel that it's very unfortunate for us as young leaders. Another thing is, we work with a lot of adolescent and young leaders at grassroots. So, whenever we go with the idea to pitch the government, like we have this number of young leaders, young volunteers from your own community who want to volunteer for you. But what the young adolescent leaders are considered at, like the TikTok generation, all they do is use social media, spend time on TikToks. And again, like that's such a powerful tool for advocacy, but that's also not taken seriously. Another thing that, I've experienced is the ageism. I don't know if you've gone through it as well. Even if as a young person, you have enough skills and capacity, especially in a larger organization where there's hierarchy, there's a very less chance for me to be promoted to a bigger role, which is already reserved for someone with more adult abilities. Because I am a young person, I am not eligible for that particular higher position in an organization. Another thing is obviously that has been highlighted below, the resources and opportunities that are not enough for us. Recently, we collaborated with this big organization, very renowned organization. And in their history, like we were the first youth organization to secure that grant from that particular organization. So they've been here for like more than 70 years, and we were the first one to partner with in our country. So, it was a moment of pride, but, it also made me very sad that, it took so many years for them to finally give such opportunities to a young organization. Another thing, because I am a young woman. Another intersectional lens that I want to apply is as young people, there's additional difficulty for being a young woman, because once you're at a certain age, you're expected to stop your advocacy and leadership activities and rather settle down and be a homemaker. So that's one additional layer of challenges that we have to go through. And yeah, that I wanted to highlight that one as well.
Thanks a lot, Bonita, and thank you so much for sharing your personal story with Sochai. And it's amazing to see that something as amazing of what your organization has done was basically taken for granted by your government until the spotlight was shone on you. And I think that's something that a lot of us running organizations or aspiring to organizations need to look out for, and don't use that as an excuse to give up. I think it shows a testament to your perseverance and still going through, even though you didn't get that initial support. And so kudos to you with that. Do we have any other final points on this topic, Pierre?
I do. It'd be remiss of me not to say something in this area. Challenges that young people and youth advocates face within this space, they're vast and they vary. And I specifically kind of waited until a couple persons shared, because I think now, and especially after you listen to me, you will hear that even though we're from different areas, different regions, the same challenges persist. There is this general idea that as young people, we don't have the skill, we don't have the knowledge, we're not old enough, we don't have the experience to speak about issues that affect us. And that frankly is incorrect. By and large, youth advocates across the world, you can go to any international conference and ask the question, what are some of the challenges that you face? And the hands will go up. And one of the words that will come out their mouth is tokenism. Because many times as young people, we're invited into rooms, we're invited into conversations to be the youth representative, to wear a lanyard and a badge that says, representative of such and such organization, and they can put in their end of year report, we sent a young person to this panel, and they took nice photos, and here are the photos for our magazine. I think these are the frustrations that we have as youth advocates. And again, these are the challenges that we have as youth advocates. To be a bit more specific, finance. Joab mentioned it, and I'm going to mention it again because it's an area that I think I should start speaking about more. And when I was younger in this space, I felt it's a bit taboo for me to bring this up. A 15, 16-year-old telling people that, you need to help me financing my advocacy. I felt a little out of place, but after growing in this space, it is important for organizers, organizations, funders, supporters to understand that it takes a lot for young persons to advocate. I'm here today and I'm on this webinar and I'm speaking from my MacBook, and I have an iPad that I take my notes on, and I prepare my speech on this device. No organization provided this for me. But this type of advocacy, this type of involvement and engagement is important to them. But no one will think about the cost of the electricity for me to be here, the internet connection for me to log on, the money to buy appropriate clothing to be on, to be able to have breakfast, to be here this morning and speak to you without keeling over. These are all practical considerations of what it takes to be a young leader and takes to be a youth advocate. And to the young persons who are on the call, I want you to understand that in the beginning of your advocacy, it's going to be difficult. In the beginning of your leadership journey, it is going to be challenging because you will find that most of the time you have to kind of bang on the door to get in. You're kind of screaming at the door to get in and be a part of the conversation. And I know it may feel weird because they're inside of that room speaking about an issue that affects you personally. If they're talking about transplants, they're in there speaking about an issue that affects you personally. They're talking about mental health. They're in there speaking about an issue that affects me personally. And they're also making policies that will be charting the way forward for governments and organizations for the next 5, 10 years to come. Why am I not in that room? This is the issue. So as you start out, you will realize that you have to stand on the highest platform and scream at the top of your voice, listen to me. And over time, you may be recognized by an international organization who may give you some funding, or you may be seen on an international platform and they would say, oh, hey, that's the guy from Barbados, or hey, he's from the Caribbean. And then all of a sudden there's this warm, loving embrace that you receive. But even then, I want you as young people to be cautious and aware. And I want you to understand your value. Because even at that moment where you're being embraced because you've been internationally recognized, I think it is important for you to understand not to sell yourself short. Your stories and your experiences, your knowledge, it is valuable material. It is top dollar material, not saying that in every instance you should be paid for your advocacy. Those who are meaningfully supporting you, and it doesn't have to be financial all the time. It could be in capacity building. The Healthy Caribbean Coalition and NCD Child have done brilliant work in building the capacity of all of us on this call. I mean, I met Joab through one of NCD's Child's conferences, and I also met Bonita through one of them. And so that type of networking and connection is also valuable, I guess, funding towards young people. So be aware that it's not easy. It's going to be challenging to start out, but you need that passion. And once you have that passion, you have that drive, it can take you as far as you can go. And then everything else, hopefully some organization or group recognizes the worth of your value and chooses to fund or invest in your advocacy or leadership. But it's not an easy road. And I wouldn't sit here, and I don't think any of us will sit here and tell you, no, it's all, roses and traveling all over the world and speaking on platforms. It isn't that easy. It takes a lot of work. And you have to be committed.
Thanks so much for sharing that, Pierre, and really, really powerful points. And I love that at the end, you started talking about, with organizations eventually taken to the point to fund you, and it might not be easier, but it may eventually get there. And sometimes it may not, but you still have to, once it's important to you, you still have to continue persevering and pushing through. And that brings me to my other question that I wanted to pose to the panelists. So what can organizations do now to build up their younger generation? And I would like to put that to all of our panelists, but I see, Danielle, you're ready and your mic is off and raring to go. So I'll have you start.
Yes, and I'm ready. And again, just wanted to amplify some of Pierre's points. A couple of things I have to highlight. It's so important. I know we have some allies on the call. It's so important that as allies, whenever you see any issue being raised regarding youth, that you don't see youth in the room, or even if you do, advocate for more youth to be there. So one specific example I can think about is the Heart and Stroke Foundation of Barbados. Barbados, as some of you may know, recently launched their school policy, school nutrition policy, and they looked around in the room and saw no youth there. They pushed, they advocated, and they got youth in that room to help consult on that policy. So these are some, examples of, allyship. We need the allies to continue to push for the youth voice. Another thing from HCC's standpoint is to have youth engaged in the organizational structure of an organization. So HCC has always prided itself on having the youth as part of its staff, the youth taking on consultations and leadership roles and ensuring that those opportunities are available specifically for young people. So that's another thing that organizations should take upon themselves. Capacity building. So Pierre spoke about it. We know how important it is. All of our panelists have spoken about it, but I think an important thing to consider too is to ask the youth advocates what they need to feel more confident and competent in the spaces that they advocate for. And then lastly, because I know we have some other panelists who I'm sure want to share their thoughts as well, is the networking piece. So from HCC's point of view, thankfully, we are able to be engaged regionally, but also internationally. And one of the reasons, we kind of formed and grew Healthy Caribbean Youth is that we saw a lot of opportunities and a lot of organizations asking for youth representation and youth with diverse backgrounds. And we just didn't have a formal group to kind of offer those opportunities to. So again, continue to look out for opportunities for youth to network regionally and internationally. And with that, I'll hand it back over to you, Steph.
Very, very important messages. And I wholeheartedly believe that organizations should really focus on capacity building. That is so, so important. And they love to say that we are the next generation and we are the future, but in order to secure the future and to ensure the future is in good hands, as if they build us up now. So I really want to hammer that home.
Oops, I think Stephanie's stuck a bit. But I'll jump in and I'll tell you about what I think organizations can or should do. I think it is important for organizations to recognize the value of the people they're engaging and the value of the youth that they are bringing into their spaces. I think it's important for them to see young persons and the engagement with young people as not just a strategic action for us to have better visibility, but as something that is really useful for the development of your group, your advocacy, your movement, et cetera, et cetera. We have the skills. Another thing I want to speak about is mentorship. I would love more organizations to provide targeted mentorship to young people and youth advocates. I'll tell you, I think personal stories are the best way to get messages across. When I first started out in health advocacy, and it was with the Healthy Caribbean Coalition. And I tell you what, I was asked to attend a meeting just as a student from my school. They were speaking about health concerns, about the school nutrition policy. And this was probably in 2015. And I spoke as a passionate young person because I felt like these are things that needed to be said that I wasn't hearing in the room. And I wanted these people in the room not to leave with the wrong perception about what they should or shouldn't be doing for young people. And, after that, I don't know how many of you know of Sir Trevor Hassel, but Sir Trevor Hassel came to me afterwards and he was like, hey, Pierre, I don't know what you're doing right now. I don't know if you're in school or what, but, the Healthy Caribbean Coalition could use a voice like yours. And we would love to support you in your advocacy, whatever you may need, if that we have to give you the skills or train you with the skills. But I see something in you and you have this passion and drive and this organic way to bring across the messages. And, HCC would like you to be a part of the team or part of the family. And it wasn't like immediately, let me know, kind of take the job now, Rihanna locked in a room, are you going with Jay-Z or not situation. It was take some time to think about it and get back to us. And that was the best decision I've made. I have never felt more engaged, welcomed, respected, valued in any group than I have with the Healthy Caribbean Coalition, because there's youth engagement at every level. The quality of youth engagement goes beyond signing off on something. It goes beyond just attending meetings. It's very much, we are involved and integrated into the body, the belly of the system, so that I'm there for the CSO meetings. I'm invited to board meetings. I'm invited to conversations about how we take the organization forward. I have helped to develop agendas. I recently completed a childhood obesity prevention rights-based agenda, and HCC provided the funding for me to do that type of research and create that document to share with others. And that is the type of support I want other organizations to provide to young people. Also, I think as a final point, networking and building groups. For me, and I'm not sure the other youth advocates can speak to this, being a part of a group of young people, a group of like-minded young people is so useful for you, and it helps you to keep your drive going. Being able to reach out to a friend from Barbados, a friend from Egypt, a friend from Pakistan, being able to have those connections helps you in your advocacy, because then you know what, I'm not in this alone. I have support. I can reach out for support. I have a friend from Pakistan that I met probably 3-4 years ago. And every single year he messages me on my birthday to say happy birthday. We met at one youth conference, and that connection just feels very genuine. And for young people and youth advocates, when sometimes we can feel burnt out, it is important for us to have that connection and connectivity. So I would love to see more organizations and youth bodies create networks for youth to engage with each other organically. And also, the one final point, because you find one person who you think is a good leader, who may be a good leader, it does not mean that you can't support others. A jack of all trades is a master of none. I am not able to speak on issues relating to finance. I'm not able to speak on issues related to the medicinal side of certain health aspects. So don't call Pierre to be a youth advocate for that. You need to invest in someone else to do that. And so as young persons, you also need to understand that there are limits to what you can do as an advocate, and don't let any organization or group push you to speak on things that you're not passionate about or you're not informed on. It must always feel real to you. Yeah.
Thanks so much, Pierre. I see, I think you had some final points you wanted to add to this for what organizations can do.
Yes, thank you. Probably very quickly, I just want to say that for organizations, I really think they have to be intentional about engaging young people within their staff. So recruiting young people, be intentional about the fact, and also even in the board of organizations. So when they are recruiting, at least young people should sit on the board of those organizations. But lastly, also create space for internship programs. It could be paid or unpaid, but internship programs that will build young people professionally to be able to recruit them to become full-time staff within the organization. Those are my three requests for organizations. So one, they should be intentional about recruiting young people within the staff and within the board, and also create or provide internship opportunities for young people. Yeah.
Thanks so much, our discussions today have been going on. Are you hearing me? Okay, great. Our discussions today have been going on really well. So passionate, everyone. And I've just look at the time and it's running away from us. So I would like everyone on the webinar to pose your questions in the chat, and I want to encourage our panelists to answer all of the questions in the chat. I see it's already been going on with Joab and some of our panelists, so that's really great. So if our panelists can look in the chat and answer some of the questions that our members have. I would like now to hand over to Laura Lewis-Watts, who is the project manager and for the Secretariat of Entity Child, to present now on a new advocacy course that Entity Child is launching.
Hi, everyone. Thank you for letting me just jump in here to plug our new course. It's called the NCD Child Global Advocacy Course. And this is a free online course. It's all interactive, and it covers 4 different modules that look at some of the most pressing NCD issues affecting young people. So it covers a little bit about burden of disease and the epidemiology, how there are certain effective strategies to deal with, prevent, or manage NCDs. And then finally, there's a module on becoming an effective advocate. So some really hands-on practical exercises that you can use in order to help take your advocacy skills to the next level. So I encourage you to check it out. I'm just going to put it into the chat. And please register and sign up. Thank you very much.
Awesome. Thanks so much, Laura, for sharing that information. I just want to highlight that this is a free course. Persons on the call, this is a free NCD advocacy course. So log on, learn more about advocacy and leadership and everything to do with it. So before we leave today, and before we leave some more resources in the chat for our audience, I wanted to ask one final question to our panelists. In 30 seconds or less, really briefly, what piece of advice would you give young people who are interested in becoming young leaders? Who would like to go first? I'll start with you, Pierre.
30 seconds or less. Okay, so I want you to know your value and worth as a youth advocate. I want you to know that whether you are living with a non-communicable disease or not, you are an expert in your own right, because no one knows better the issues that affect you than yourself. So it's important for you to share those experiences. You don't have to be an academic born with the capacity to speak 5, 6, 7 languages. But just the passion and drive to create positive change with the correct capacity building and the right platforms, you too could be a young leader and youth advocate. And what I really want you to leave with is to understand that you are valuable as a young person as a youth advocate, and you should be treated as such. Yeah.
Thanks so much, Bonita. Final thoughts, advice?
Just a practical advice that, I keep reminding myself as well is sometimes the journey of advocacy and leadership can be very challenging and difficult. And you might feel the pressure to live up to the expectation of everyone around you. In such times, please don't be afraid of failure and don't be too hard on yourself, because all of us are in this learning journey and we're evolving every day. So it's important that we normalize the failure and that, normalize that you don't have to figure out everything right here and right now. Because as advocates and leaders, we as human beings are also in an iterative cycle. If our version 1.0 doesn't work, then maybe version 2.0 might. So we are all learning here, and let's work on ourselves to become a better version of ourselves. Thank you.
Thanks, Bonita. Joab?
Your voice is valuable and powerful as a young advocate, and especially for people living with NCDs. If you have a condition, your voice is very valuable. And connect with others who have the same interests. Like connecting with you guys here has been so refreshing for me. So please look out for people who are in the same space, who can inspire you when things get a bit tough, so that you can stand up and speak again. And lastly, do your homework. Do your homework, research. I know Enow talked about it. Invest in yourself so that you're able to give. You can't give from empty. You need to really fill yourself up so that, yeah, you can go out there and make an impact. Thank you. Back to you, Stephanie.
Thanks. Danielle, rapid fire.
Rapid fire. Two main things: continue to invest in yourself personally and professionally. And I think one thing that everyone has said is be kind to yourself. This road is not easy. And last thing that's really helped me is speak to people about their experiences. I think you'll find out that there's no single road to becoming a leader. And the more conversations you have, I think the more that will become clear.
Very true. And Enow, final advice.
Thank you very much. For me, I would say believe in yourself. It's okay to fail. Everyone fails. But when you fail, be quick to rise up and continue the journey. Believe in yourself. It's very okay to fail. I have failed many times and I will continue to fail. But the good news is when I fail, I learn from it and I will definitely succeed. Thank you.
Thanks, Enow. What inspiring words to finish on. I think that has been such an amazing session today. And thank you so much to all of our incredible panelists and to everybody who's participated. Also, a thank you to NCD Child for helping us to facilitate this session today. I'm so inspired. If you've enjoyed today's conversation as much as I have, we've got some resources that we're just popping in the chat, which can help to keep the momentum going. And there's a link to that, our NCD Child Global Advocacy course, and some other resources and some resources suggested by our panelists. They've all been popped in the chat, so feel free to use those links and have a look at some of those extra resources. Thank you, everybody.